Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is June 5th, 2020. Starting off with the COVID-19 statistics, as we always do. Right now there are more than 6.8 million cases worldwide, as well as there are nearly 400,000 deaths. In the United States, there are over 1.9 million cases, and it's almost certainly going to be over 2 million by Sunday evening at the latest. We're gaining in the U.S. between 20 to 30,000 cases a day. Currently, we also have over 111,000 deaths in the United States. Since the COVID-19 pandemic started, public health experts have always wanted to have more data on the virus. It's something that we've always been short on, and it's caused some issues. Because of that lack of data, we felt like we're fighting the virus with our hands tied behind our back. Recommendations put out by the CDC and WHO have been just general suggestions for any type of disease that's similar to the coronavirus. Over time, as we got more data, we were able to make specific suggestions for COVID-19. Generally speaking, though, public health experts got it pretty much right, as far as we now know. Most missteps were not caused by the public health experts themselves, but most of them were caused by government leaders deciding not to follow the public health experts' suggestions. Thankfully, we now know a lot more than we did before. We're also getting a lot more testing done, and so the numbers in the reports are actually becoming a lot more accurate. As we talked about last week, the best way to avoid spreading or getting COVID-19 is to practice social distancing and to wear a mask. Whether you have symptoms or not, you should be wearing a face mask anytime you go out in public. Washing hands and disinfecting surfaces is also important, but specifically for COVID-19, we've found that it's not as important as we used to think. Early recommendations for face masks were completely wrong. That's one place where we just didn't have enough data, and so public health experts just got that one wrong. We started out by thinking that we did not need the face masks because every test we did to see if the face masks stopped the virus from getting into people, into the respiratory system, showed that unless you had an N95 mask, it pretty much didn't work. Even with the N95 mask, it had to be fitted correctly, you had to know how to use it. And there was a huge shortage of those N95 masks, so we just basically said don't use them. Only recently have they started doing tests on how well face masks, even just simple homemade fabric ones, do at keeping the virus in. So if a person is sick, whether they're showing symptoms or not, how well does it keep that virus in and keep it from spreading to other people? And we've found that pretty much any mask will work very well. It's very effective in keeping virus in. That's why now we suggest that everyone going out in public, whether you're showing symptoms or not, you should be wearing a face mask. One of the reasons why, even if you're not showing symptoms, you should be wearing a face mask is because COVID-19, for many or possibly even most cases of COVID-19, patients just do not show symptoms. Or if they show symptoms, they're very mild, and they're confused with the common cold or flu, something like that. This week, it was announced that a new project called Fix the Mask is trying to make both surgical masks and fabric homemade masks more effective. They've designed a rubber sheet that fits over the mask along the edges of the mask to keep those sealed. That way it keeps the virus from getting into the mask. This can also be done quite effectively just by using household rubber bands. You take 3 rubber bands, tie them together, and then place them in a certain way. If you want to see that process of doing so, I've actually linked to a video in the description, and up in the upper right hand corner of this video right now, you can go ahead and click a link there also. And that'll take you to that video that shows how to do that. Another side effect of the early lack of data was many people believing that herd immunity could be an effective method of dealing with COVID-19. Many people still believe that herd immunity, meaning not practicing social distancing or even trying to get sick, trying to get the virus, many people believe that that's the best way to go even now, even though that theory has been thoroughly debunked. We talked about it quite a bit the last couple of weeks, but this week we have a new report. The person in charge of the COVID-19 response in Sweden has actually come forward and said, yes, I made a mistake. We never should have done we never should have relied on herd immunity. He said if they could do it over again, he would have chosen to close down some things. Not everything, but at least some things. Currently, even though Sweden doesn't have the highest total number of cases or deaths, it does have the highest number of deaths per capita of any country in the world. So that it definitely didn't work. It was a colossal failure trying to do the herd immunity thing. This week's CDC Director, Dr. Robert Redfield, said that they're worried that the American public isn't following the recommendations that the CDC has given on COVID-19, and they're just not taking it seriously. He said, if recommendations are not followed now, we will likely have a resurgence of cases in the late summer or early fall. Even right now, we are already seeing in some areas a resurgence of those cases. The past couple of weeks, we kind of saw a little bit of a plateau of new cases, or even a decrease to some degree. But now that plateau is starting to slowly increase a little bit. So we need to work on that. A follow-up story from last week. Last week I mentioned that the WHO had stopped testing hydroxychloroquine as a treatment for COVID-19 because of concerns of increased risk of death or heart problems. This week they decided to restart those trials. The main reason for that is because the study that had been done, or the data that had been part of the study that said that there was an increased risk of death and heart problems, that data is suspect now. The company that provided the data may have produced or provided fraudulent or at least inaccurate data. And so as of right now, the WHO and many other places or organizations that are testing hydroxychloroquine have decided to continue those tests to determine if it really does work. For the time being, they still recommend that not being the primary way that you treat the COVID-19, since so far there really isn't any proof that it does work. Two last quick bits of information about COVID-19. Scientists have found that the virus originally came from a bat and then went through a pangolin. A pangolin is kind of like a spiny anteater, kind of, but it's looks like an armadillo almost. But it's something that they have in Asia. Sometimes it's eaten, and so they say that it probably came through the pangolin based on the studies they've done of the DNA of the virus, or the genetic makeup of the virus. They say that there may possibly be a third unidentified animal still that it went through. Studies have also found that though infection rates seem to be evenly distributed among all people after taking into consideration the rate of exposure, the severity of the disease is worse for certain groups of people. We already knew that it was worse for the elderly, those who are immune compromised, men, blacks, and the poor, and this week they actually found out that those with type A blood seem to have a harder time getting rid of the virus. They have more severe symptoms happening to them. The studies still haven't been able to determine why those specific groups have more severe symptoms. As a last note of this week, we at Plain English Public Health wish to address the unrest that's been happening throughout the U.S. and the world because of the avoidable death of George Floyd and other people of color. We condemn all acts of racism and stand by our black brothers and sisters. We are saddened to see the violence being perpetrated, both against blacks by police and others, and in the rioting that has followed. We sincerely hope for peace and change. Peace without change will not be sufficient. There have been many comments in the media about Black Lives Matter, Blue Lives Matter, and All Lives Matter. In public health, we are trained to assess needs first. We don't try to fix issues until we know the needs of the population we're serving. During that needs assessment, two of the most important things we can do are to figure out what the highest priority is and what our target population sees as their needs, not just what we see. Applying that to our current situation, we must come to the conclusion that while all lives do matter, the priority right now is black lives. Lots of studies confirm that racism, especially against blacks, is still alive and well in the United States. This cannot continue. As we work toward fixing the scourge of racism in our country, we must know and respond to the needs of the black community. This will require a discussion, not finger-pointing. It will require open-mindedness and humility to accept others' opinions. It will require getting along with others, not looting and vandalism. To everyone watching this weekly report, please open your hearts and minds and work together to eliminate racism once and for all. I'm Richard Greenland, and this has been the Plain English Public Health Weekly Report for June 5th, 2020. Have a great week.